In this morning's Woman's Doctor, if turning doorknobs or opening jars is painful, it could be a sign of thumb arthritis. Osteoarthritis is the most common type of arthritis affecting the thumb. It's a degenerative breakdown of the cushioning of the cartilage of the joint where the base of the thumb meets the wrist. It occurs most often in women over the age of 60. And Mercy Medical Center Dr. Clayton Alexander says it's the most common in women for several reasons. Women have very subtle anatomical differences in their thumbs and slightly looser ligaments than men, leading to more wear and tear. And Dr. Alexander is joining us this morning with more. Thanks for joining us.
Hi, thanks for having me.
So what are some of the symptoms of thumb arthritis?
The symptoms are largely pain with activity of using the thumbs. Some of the really common activities are opening jars or grasping things, wringing out towels, etc.
Show us on your thumb, if you will, where we're likely to experience that pain.
Sure, in this area
Okay.
right here.
Right there. So
sometimes it could radiate up and down. Largely it's called.
right there. Okay, so what are some of the treatment options if you have this?
We always start with the least invasive, least risky treatments, but there's lots of options. Over-the-counter pain medicine, prescription pain medicine. There's different things that we can give. Occupational or physical therapy, bracing, which is important, and then there's invasive treatments like corticosteroid shots in the joint, as well as lots of different types of surgery.
Talk a little bit about some of the physical therapy that's involved if you have this. Are there actual thumb exercises that you can do?
Absolutely, yeah. There's lots of different exercises in rehab for the thumb, but in particular, there's a couple strengthening exercises of certain muscles in the hand, which have been shown to decrease this particular type of arthritis.
Okay, and then I imagine when it comes to braces, that's maybe not a long-term solution to that, but maybe could really help you in the short term?
It does not cure the problem or necessarily completely alleviate the pain. It can certainly make it much more tolerable and allow you to do the things that you want to do, depending on the type of this.
And then I imagine you probably encourage your patients to look for gadgets to help you do things like open jars easier and open those doorknobs.
Absolutely, that's very important. It's called joint protection, and there's lots of different gadgets that can help with that kind of stuff.
I bet. So obviously this is something if you have pain for that you should talk to your doctor about.
Yeah, absolutely, because the treatments are so effective. And we want people to do the things that they want to do. And so if you're not able to do those without pain, then having treatment for arthritis can let you do those things.
Awesome. Doctor, thanks so much for joining us this morning. Really appreciate it.
Thanks for having me.
You're welcome. And if you have any other questions or you'd like a referral, just call 1-800-MD-MERCY.